There's been an increase in the number of men trying to replace the amount of testosterone in their bodies. Users cite benefits like more energy and better moods, but there are concerns that the therapy could increase the risk of heart problems. Doug Johnson has details.
The level of testosterone in men drops naturally as they get older. There's been a recent boom in efforts to sell supplements to replace that hormone, with claims it will boost energy, sex drive, and concentration. But little was known about the long-term impact of testosterone replacement, which prompted the Food and Drug Administration to issue a safety announcement.
It has been suggested in the past, prior to these black box warnings with the FDA, that testosterone replacement may be beneficial in certain groups of cardiac patients, such as heart failure, post-MI.
The FDA decided to reassess the safety of testosterone therapy after the release of an observational study of older men in the Veterans Affairs Health System, published in the Journal of the American Medical Association.
The objective of this study was to look at the association between testosterone use and adverse cardiovascular outcomes, including myocardial infarction, stroke, and mortality.
The studies did correlate the increased risk of heart attack and death in those over 65 years old. The patients less than 65 years old, there was a adverse outcome in that group that had coronary disease, meaning if they had had any heart attacks or events younger than 65, they were cautioned against using the medication and the replacement.
Dr. Sneed, an interventional cardiologist with the Stern Cardiovascular Foundation, says it's not clear what effect testosterone therapy has on heart attack and stroke without more research.
We don't know the exact mechanism. We know some of the things that it affects in our body, including the cholesterol and even the cholesterol breakdown, but it has been suggested that they need a large randomized trial to exactly identify the mechanism.
Currently, the only testosterone products approved by the FDA are for use in men with no or low testosterone in conjunction with an associated medical condition, such as the body being unable to produce the hormone because of a genetic problem or chemotherapy. And many doctors urge caution for using low T treatments as a fountain of youth.
Always give them a word of caution. I don't think they should use it as a blanket replacement to make them feel young again and stronger. But if there is a refractory condition related to the low testosterone, i.e. Severe depression, osteoporosis, and other things that would medically necessitate that hormone replacement, then they should use it with caution. Otherwise, I generally tell them to wait until we get more information to clearly identify the benefits outweigh the risk, because right now it does not appear to be that.
For Smart Medicine, I'm Doug Johnson.